Hello and welcome to Diabtron. Today, we're going to delve into a crucial topic for expecting mothers: gestational diabetes. It's important to understand what gestational diabetes is, its symptoms, causes, and how to manage it for a healthy pregnancy. What is gestational diabetes? Gestational diabetes is a type of diabetes that develops during pregnancy, specifically in women who did not have diabetes before they were pregnant. This condition occurs when the body is unable to produce enough insulin, a hormone that regulates blood sugar levels, to meet the increased needs during pregnancy. Insulin helps glucose, sugar, from the food you eat enter your cells to be used as energy. During pregnancy, the placenta, which connects the baby to the mother's blood supply, produces hormones that can interfere with the way insulin works. As a result, gestational diabetes can develop, leading to elevated blood sugar levels. Gestational diabetes typically occurs around the 24th to 28th week of pregnancy, when the body's insulin needs are at their highest. While the condition usually goes away after childbirth, women who have had gestational diabetes are at a higher risk of developing type 2 diabetes later in life. Symptoms of gestational diabetes. Gestational diabetes is often referred to as a silent condition because it typically doesn't cause noticeable symptoms in pregnant women. Many women with gestational diabetes may not realize they have it unless they are screened during their prenatal care. However, in some cases, women may experience mild and non-specific symptoms. These symptoms can include increased thirst, polydipsia. Polydipsia is a medical term used to describe excessive thirst and an abnormally increased desire for drinking fluids. In the context of diabetes, polydipsia is one of the classic symptoms of both type 1 and type 2 diabetes, as well as gestational diabetes. It occurs due to the body's response to elevated blood sugar levels. In diabetes, when blood sugar levels are consistently high, hyperglycemia, the kidneys work to remove the excess glucose from the blood by excreting it in urine. To do this, the kidneys require more water, leading to increased urination. This increased urination, in turn, can cause the body to lose fluids more rapidly, resulting in dehydration. To combat this dehydration and the loss of fluids, the body triggers a sensation of intense thirst, polydipsia, to encourage the individual to drink more fluids and rehydrate. As a result, people with diabetes often feel the need to drink more water or other liquids to quench their thirst. Polydipsia is one of the three classic poly symptoms of diabetes, along with polyuria, excessive urination, and polyphagia, excessive hunger. These symptoms can be indicative of poorly controlled blood sugar levels and are common signs that should prompt individuals to seek medical evaluation and potentially receive treatment for their diabetes. Proper management of blood sugar levels is essential in reducing and alleviating these symptoms and the associated health risks. Frequent urination. Polyuria is a medical term that refers to excessive urination, which involves the production of abnormally large volumes of urine over a short period of time. In the context of diabetes, polyuria is a common symptom, and it is especially associated with elevated blood sugar levels. Here's how polyuria is related to diabetes. Elevated blood sugar levels. Hyperglycemia. In diabetes, when blood sugar levels are consistently high, the kidneys need to work harder to remove the excess glucose from the bloodstream. They do this by filtering glucose out of the blood and into the urine for excretion. Increased urination. Because the kidneys are filtering more glucose into the urine, the volume of urine produced increases. This results in more frequent trips to the bathroom to urinate. Fluid loss. Excessive urination leads to the loss of a significant amount of fluids from the body, which can result in dehydration. This loss of fluids can also contribute to another common diabetes symptom, polydipsia, excessive thirst. Polyuria as a symptom is one of the classic poly symptoms of diabetes, along with polydipsia, excessive thirst, and polyphagia, excessive hunger. These symptoms can be early indicators of diabetes or signs that blood sugar levels are not well controlled. Fatigue. Feeling unusually tired or fatigued can be a symptom of high blood sugar levels, although it's a general symptom that can be attributed to many other causes during pregnancy. Blurred vision. Some women with uncontrolled gestational diabetes may experience temporary vision problems due to changes in fluid balance in the eyes. Nausea and vomiting. Although not specific to gestational diabetes, some women might experience nausea and vomiting during pregnancy, which could be aggravated if blood sugar levels are elevated. Frequent infections. High blood sugar can weaken the immune system, potentially making women with gestational diabetes more susceptible to urinary tract infections or yeast infections. It's important to note that these symptoms are not unique to gestational diabetes and can often be attributed to the normal changes that occur during pregnancy. Causes and risk factors. Now, let's talk about the causes and risk factors associated with gestational diabetes. While the exact cause isn't clear, it's believed to be a result of hormonal changes during pregnancy. Risk factors include being overweight before pregnancy, a family history of diabetes, having previously given birth to a baby weighing over 9 pounds, being over the age of 25, diagnosis and testing. If you have risk factors or are experiencing symptoms, it's essential to get tested for gestational diabetes. This usually involves a glucose challenge test or a glucose tolerance test, which can be done at your doctor's office. Complications. Gestational diabetes can lead to complications for both the mother and the baby. These complications may include high blood pressure, preeclampsia macrosomia, overly large baby, low blood sugar in the newborn preterm birth management and treatment. The good news is that gestational diabetes can be managed effectively. Treatment typically involves monitoring blood sugar levels regularly, eating a balanced diet, exercising regularly. Sometimes, insulin or oral medication may be necessary. It's crucial to understand gestational diabetes, its symptoms, causes, and how to manage it. To reduce your risk of developing gestational diabetes, maintain a healthy lifestyle and attend regular prenatal checkups. Remember, knowledge and early detection are your best allies in managing gestational diabetes during pregnancy. If you suspect you might have gestational diabetes, consult with your healthcare provider as soon as possible. Thank you for joining us today. If you found this video helpful, please like, share, and subscribe for more informative content. And if you have any questions or experiences to share, please do so in the comments below. We'd love to hear from you.